Buenas tardes, colegas.
Good
Soy
afternoon,
Carla
colleagues.
Sáenz, soy
This is
asesora
Carla
regional de
Sáenz, Regional
bioética de la UPS,
Advisor on
el
Bioethics
programa
for
regional de
PAHO.
bioética
For
hace
the
parte
regional
del
and the
Departamento de
regional
Sistemas
bioethics
y
programs is
Servicios de
part of
Salud.
the Health Systems and
Antes de
Services
continuar,
unit.
quiero
But
asegurarme que
before
todos saben que
we
tenemos
continue, I
traducción
would like
simultánea.
to double check and make
Please
sure that
notice
everyone
if you
knows that
want
we have simultaneous interpretation.
just use the little globe on the bottom right of your screen and you can choose the channel, the language of that you want to hear. Es un gusto estar con
It's a
ustedes en
pleasure to
este
be
segundo
with
seminario
you in
de
this
la
second
serie sobre el
seminar of the series
fortalecimiento de los
on
sistemas nacionales
strengthening
de ética de la
national
investigación.
research ethics
Quiero iniciar
system. I would like to
reconociendo que
begin
este
by
trabajo de la Organización
acknowledging that
Panamericana
the
de
work
Salud
done by the Pan
está
American Health
financiado por el
Organization
Wellcome
is
Trust
funded by the
y
Wellcome
que fue
Trust
iniciado a
and that
solicitud de
it
los Estados
started
miembros de
at
la
the
OPS
request
en el
of PAHO's member
2018.
states in 2018.
Esta sesión busca
This
compartir
session
una
seeks
evaluación
to
regional
share a
usando los
regional
indicadores
assessment
que
using
presentamos
the
en la
indicators that
sesión
we
previa en el primer
presented
seminario de
during
esta
the
serie
first
y
series,
que
the
han
seminar of
sido
this series,
publicados
and that were
por la
posted
OPS.
by
Ustedes
PAHO.
pueden ver
And then
en
you
el
can
chat
see on the chat
las publicaciones en
that
inglés y en
we have
español,
the
así
publications in
como los
English and
videos de
Spanish,
la sesión
as
previa.
well as the video from our
Como decía,
previous
esta
session.
sesión busca
As I was saying,
compartir una
this
evaluación
session seeks to
regional
share
usando estos
a regional
indicadores
assessment
con
using
el
these
objetivo de que
indicators with the
reflexionemos
purpose
juntos
of us
en este
reflecting
espacio que tenemos de
together
diálogo y
during
reflexión
this
regional
session that we
sobre
have to
los
reflect as
logros
a
que hemos
region
tenido
on the
y sobre
achievements
los
that we've
desafíos
had,
que estamos
as well as
enfrentando.
the challenges that still lie
Nos
ahead.
acompaña el día de
We are
hoy
joined
el doctor
today
Bernardo
by
Aguilera,
Dr.
que es
Bernardo
médico y
Aguilera,
bioticista
who
con
is a
un doctorado en
bioethicist with
filosofía.
a PhD in
Es un gran
philosophy
colaborador del
and
Programa
is a
Regional
great
de Bioética
collaborator
de la
for the
UPS.
Regional
Esta
Research Ethics
colaboración con el
Program at
doctor
PAHO.
Aguilera
This
se
collaboration
inició
with
cuando él
Dr.
estaba haciendo
Aguilera
su
started when he
investigación
was doing
postdoctoral en
his
el
postdoc
Departamento de
research
Bioética
at the
del
Bioethics
Centro Clínico
Department
de
at the
los Institutos
Clinical
Nacionales de la
Center
Salud,
at
NIH
the
por su sigla en inglés,
NIH,
antes del
National
inicio
Institutes
de
of
la
Health,
pandemia del
before the
COVID-19.
beginning of the COVID-19 pandemic.
Ahora él está formalmente
Now
apoyándonos
he
desde su
is currently
nueva afiliación
supporting
en
us
la Facultad de
officially
Medicina y
as
Ciencia
part of
de la
the
Universidad de
Medicine and
San
Science
Sebastián,
School at the San
Santiago de Chile.
Sebastián University
Nos
in
acompaña
Santiago de Chile.
también Sara
We are
Carracedo, a
also
quien
joined by
ustedes
Sara
conocen ya,
Carracedo,
que es
whom you
abogada de
know already,
formación con
who
una
is
maestría en bioética
an
de la
attorney
Universidad de
with
Melbourne en
a
Australia, que
master's
es un
degree in
centro
bioethics from
colaborador
the
de
Melbourne
bioética de
University
la
in
OPS
Australia,
y
which is a
OMS
collaborating
y
center for PAHO
consultora del
WHO,
Programa Regional
and
de
she's a
Bioética
consultant for
de
the
la
regional
OPS.
bioethics program
Para
at
la
PAHO.
sesión de hoy,
For today's
les
session,
agradecemos
we
que
would
usen
very
el
much
chat
appreciate it
para
if you could use the
compartir
chat
material
to
o
share
hacer
material
comentarios
or
y
make
que nos
comments,
envíen sus
and to
preguntas
please
para el
send us
resto de la
your
discusión
questions
usando la
for
sección de
the Q&A
preguntas y
session by
respuestas,
using the Q&A
la función
button
del Q&A que está en la barra
that you can see
inferior
at
de
the
su
bottom
pantalla de Zoom.
of your Zoom screen.
Em, Como habíamos indicado en la sesión previa,
As we said in
el
our
espíritu
previous
de esta
session,
sesión, el
the
espíritu de
spirit of
esta
this
serie es de
session and this
diálogo y
series
de
of sessions
reflexión.
is
Como decíamos en la
discussion
sesión
and
previa,
reflection.
el
Like we said
objetivo
in
es
our
de que
previous
los
meeting, the objective
indicadores
would be
catalicen el
for the
progreso de nuestra
indicators to
región.
catalyze the
Si fueran muy
progress made
fáciles de
in our
lograr,
region. If it
no
was
lograrían,
easy to do,
no habrían
we
conseguido su propósito de motivar un
they would
progreso
have
de
not
nuestra
made
región.
the
Como
meet the
nos
objective of
compartieron en el seminario
motivating
pasado,
progress in the
nuestros
region.
colegas de las
Like we said in our
autoridades
previous session,
sanitarias de
our
Perú y
colleagues at the health
Panamá,
authorities
en
in
su
Peru and
experiencia,
Panama
los indicadores han catalizado el
say that
progreso
in
en
their
nuestra
experience,
región.
their indicators catalyze
Sabemos
progress
que la
in our
región de las
region.
Américas
We
está
know that the
frente a un
region of the
avance
Americas
sostenido en
is
materia de
making
ética en la
significant
investigación
progress in terms of
y también sabemos que
research
muchas
ethics.
actividades
And
se
we also
hacen,
know
pero
that a
que no
lot of the
están
activities take place,
formalizadas o
but
institucionalizadas.
they're not formal or they're not
Parte
part
de
of
esta
the
iniciativa
institutional program.
busca
So part of the
facilitar que eso
initiative
ocurra.
is to make sure that
Eh,
happens.
es una, am, vamos a hacer, nuestros colegas
So
Bernardo y Sara
our
van a hacer la
colleagues Bernardo
presentación
and
y luego
Sara
tendremos
will
un
give a
momento de diálogo
presentation and then we'll have
y de todos
some time for discussion. And if you notice that there's any information that's missing or anything that we are leaving out in our review, we ask you to please share that information via the Research Bioethics program, which I will share with you briefly on the chat. We know that we are lucky enough starting last year when we had this series on the regional dialogue to have this time to share regionally where we are and what kind of tasks we still have pending. And we know that as part of this reflection, we're not only providing support to a region, but that it is also very valuable for other regions and other countries that are outside the region of the Americas who want to strengthen their national research ethics systems.
A Bernardo,
Before giving the floor to Bernardo, I would like to take this opportunity to invite you to our next session for this series, which will take place November 15th. And I will share on the chat as well the link for you to subscribe to the research ethics mailing list if you're not already part of that. So once again, Bernardo and Sara, thank you so much for joining us. And thank you so much to our participants for joining us for this regional reflection session. And without further ado, I'd like to give the floor to Bernardo. Go ahead. Thank you so much, Carla. And thank you to everyone that's joining us. And I am now going to share my screen. Can you see it?
perfecto.
Yes, perfectly well.
Para introducir la revisión que hemos estado
Well,
haciendo,
to introduce you to this review that we've done, I would like to begin by going over the indicators. And like we saw in the previous session, the PAHO member states suggested a series of strategic lines of action to promote research ethics in Latin America and the Caribbean, and with a systemic or system-wide approach. That is to say, to try to address all the aspects of research ethics in a comprehensive and robust way. And to that end, we suggested this series of indicators, which are grouped together into strategic lines of action. The first one that aims at strengthening research ethics systems, which has 4 objectives and 5 indicators. As you can see, the fourth objective has 2 indicators, and then a fifth objective with its own indicator that focuses on research ethics during emergencies. These indicators do not reflect the ultimate goal of a national research ethics systems, but rather they are reasonable goals that are not way too ambitious, neither nor too modest, and that way we can guide strengthening of national research ethics systems in each country. Now, when we talk about the current project, the goal that we've had, the objective that we had is to assess the progress of countries in Latin America and the Caribbean regarding these indicators, so progress on these indicators. We did this through a review of legal standards, official documents, and other open source information on the policies that each country has implemented regarding research ethics with humans. This project, like Carla said, was done in cooperation with Sara, Carla, and at the beginning also with inputs from Anissa Hassan Grenier.
En este proyecto, nuestro criterio de
In this
inclusión
project, our
para los
inclusion
países que fueron
criteria for the
revisados fue que
countries
los
that
países
were under
tengan más
review
de un
was
millón de
for countries to
habitantes.
have over
De
a
esta manera
million, a
incluimos a
population of
22
over a
de los
million,
23 países de
which included
Latinoamérica y el
22
Caribe
out of the
que están
33
listados a
countries in Latin
continuación.
America and the Caribbean, which you can see listed
Estos,
on the
si bien no son
screen.
todos los países, son
And
los que
even though this is
congregan
not an
la
exhaustive
gran
list of
mayoría de la
countries,
investigación que se
they are the
realiza
ones
en
that
la región.
concentrate the large majority of the research that takes place in the
Los
region.
pasos que hemos seguido
Now,
en
in
este
terms of the
proyecto
steps that we
son los
follow throughout
siguientes.
the
En primer lugar,
project, they are
si bien los
first,
indicadores
even
intentan
though
presentar de
the
manera
indicators
bastante
aim
concreta
at
cuál es el cumplimiento
showing in
del
concrete terms
objetivo,
what the
vimos que
degree
era
of
necesario especificarlos un poco más,
meeting the objective
ya que
was, we want to be a
quedaba un
little
poco
bit
más
more
de ambigüedad a
specific
veces
because sometimes there's
para establecer cuándo
ambiguity
un país había
to
logrado el
determine
indicador
whether or
en
not
realidad
the
o cuándo
country had
lo había logrado de manera
achieved the
parcial.
indicator fully or
Luego
partially.
les voy a explicar un poco más
And I'm going
cómo
to
es esta
speak about
especificación.
this a little bit more later on.
Luego enviamos a
Then
colaboradores de
the
cada
second
país de la
step was to
región
send to
la tabla
the
con
different
los
collaborators in
indicadores
the
para
region
que
a
ellos
table with
fueran
the
quienes la completen,
indicators, and we
para
asked
así
them to
tener
fill
una
that
primera
out
idea
so
de
we could have
estado
an
de avance
initial
de cada
idea
país.
of the progress each country had
Estas
made.
tablas las recibimos de
This
vuelta y
table was then sent back
revisamos
to
los
us,
documentos
and we
correspondientes para
reviewed the supporting
estar seguros de que
documents to make
cada
sure
ítem está
that each
validado por un
item
documento
was
de
validated
público.
with an open source document.
Luego hicimos un segundo envío
Then
a
we
los colaboradores de cada país a
sent
modo de una
these for
segunda
the
ronda de
second
revisión
time to our collaborators
para
as
que
a
nos digan si es que
second
están de
round
acuerdo o
of
no o
review
plantearle
to
nuestras dudas.
ask them if they agreed or
Y
not,
una vez
or to
recibido de
ask them
vuelta esta segunda
questions.
ronda,
And then in that second round,
eh,
we received all the
hicimos
documents
una nueva
back,
revisión para determinar
and we
cuáles
reviewed the
logros de
documents
los
once again
indicadores
to
en
see
cada
to
país
what degree
y
the indicators
catalogamos
had been met
los
in each
países
country. And we categorized or
como
ranked the countries
habiendo logrado
based
cada
on
indicador
having met the
totalmente,
indicator
parcialmente o
fully,
no
partially,
iniciado
or
progreso en cada indicador.
not no progress has yet
Luego
started.
llevamos a cabo una
No,
síntesis
no progress
de los
has yet been
indicadores de
made.
cada país
Then
en
we
perspectiva
summarize the
regional.
indicators for each of the
Estamos
countries with a regional
actualmente en este
perspective.
punto en una
And
reunión con colaboradores
now
de la
we are at
región
this meeting
para
with collaborators in the
socializar
region
los resultados
to
preliminares de esta
get feedback
investigación
on the
y obtener
preliminary
retroalimentación.
results of
Así
this
que hago eco de
research.
lo que señalaba
So to give
Carla
you
y
our
pedirles que por favor nos
takeaways
envíen
and to
sus
hear
dudas
feedback. So
o
like Carla said, please
comentarios,
send us your
ya sea por
questions
chat,
or
preguntas
comments
o
either
correo.
via chat or as the
Luego
Q&A
nos
or via
queda por
email.
redactar el
And
manuscrito
then
final y
what we
enviarlo al Foro
still need
Interno de
to do
Investigación.
is to do a final
Voy ahora a
drafting and
centrarme
send
en
it
estos
for
dos puntos de la
publication. I'm going
especificación
to
de los
focus on
indicadores
these
y
two
la
steps,
síntesis
specifying the
de los indicadores
indicators
en
and
perspectiva
summarizing
regional.
the indicators with the regional perspective.
A modo de repaso también de los
As
indicadores,
a
les
recap,
explico en qué
in
consiste la
terms of indicators,
especificación.
I'm going to talk about
Para el
what
primer
that
indicador, que
specification
corresponde al número
refers
de
to. For the
países que
first one, that
disponen
has
de
to do with the
leyes
number of
u otros
countries that
instrumentos
have
jurídicamente vinculantes
laws or
vinculados
other
con
legally
operaciones
binding
relacionadas con la
instruments
salud de los
that
participantes humanos.
guide um,
Incluye el
research with
requisito de
human
realizar una
participants,
revisión ética por parte de un
including
comité
the
independiente.
requirement for ethics review by an
Lo
independent committee.
especificamos estableciendo que el
We
instrumento jurídico en
specify that
cuestión
saying
debe
that
abarcar
the
todos los
legal
bienes en
instrument
salud
had
con
to
seres
cover
humanos y no solo
all
un subgrupo. Así,
research
por
with human
ejemplo, si
participants
la
rather than a
legislación del
subgroup.
país
So, for example, if
solo le
the national
prescribe la
legislation
revisión ética
only
de ensayos
required
clínicos para productos
the ethical
farmacéuticos,
review for
ese
example,
posicionamiento sería
pharmaceuticals
parcial
review,
del
that
indicador.
country would be partially meeting the indicator.
Para el segundo indicador,
Now,
el
in terms
número
of
de
the
países
second
que
indicator,
cuentan
which is
con
the
un
number of
ente nacional
countries that
encargado de la
have a national
supervisión de
body
los
tasked with
proyectos de
the
ética,
oversight of the ethic review
incluidos
committees,
mecanismos de registro,
including
capacitación y cumplimiento de
mechanisms
las
for
reglas,
registration, training, and compliance,
especificamos que este ente
we
debe estar
specify that
constituido mediante un
this
documento
body
oficial,
had to
o sea,
be made up by an
tendría que haber un
official
documento oficial
document.
que
So there had
señalara
to be an official document
que se crea este
saying
ente
that
estableciendo
this body
los
was being
objetivos y
established with
funciones.
the respective roles and
También buscamos
objectives.
evidencia de
We
funcionamiento
also look
públicamente
for evidence
accesible de
that
este ente, por
this body
ejemplo,
was
a través de la
working and
página
that
web
was
del
in open
Ministerio de
source, for
Salud
example,
del
through the
respectivo país.
website of the Ministry of
También
Health from that
este ente
country,
abarque la
and to
supervisión
also
de
have
toda
that
investigación
body
en salud con
cover
seres humanos y no
all
solo un subgrupo.
research
O sea que al igual que
involving human
el
participants rather
indicador
than a
anterior,
subgroup. So just like with the
el
previous
requisito para
indicator,
cumplir con este indicador es
in order to meet this
el ente
indicator,
nacional
the requirement was for this national body to aim at supervising all kinds of research, not just, for example, clinical trials for certain pharmaceuticals. In terms of the third indicator, the number of countries with policies that support research ethics, training for investigators, and ethics review committees, in addition to having policies for both groups, that is to say, researchers and committees, this training must be uh, mentioned explicitly in official documents in order for this indicator to be met, or fully met rather. In terms of the fourth indicator, number of countries requiring this prospective registration of clinical trials in accordance with WHO standards, we said that this requirement had to also be listed on official document, and it had to be on the databases from the International Registration for Clinical Trials platform. And in terms of policies for responsible conduct of research, we said that these policies had to be backed up by official documents and include at least definitions of manufacturing, counterfeiting, and plagiarism. Finally, the indicator on policies for accelerated ethics review during emergencies, we said that the procedures had to also be provided for in an official document and be specific in terms of the steps that needed to be followed in order for this accelerated ethics review to take place. Now, having gone over the indicators and how we try to specify them, this is a summary of the outcome of our research. And as you can see, the first two indicators, the one that requires having a legal instrument for health-related research with human participants, as well as the one that requires having a national body tasked with the oversight activities, are indicators that at the regional level have a significant level of achievement, either fully or partially. Now, the next two indicators, the policies that support research ethics training for investigators and committees, as well as to require the prospective registration of clinical trials in accordance with WHO standards, we can see that it has been partially met.
Que los últimos dos indicadores,
Whereas the final two indicators, having policies on responsible conduct of research and having established procedures to do accelerated ethics review during emergencies, these are the indicators where the majority of the countries are yet to show any kind of progress. So it's still to be met. This is in very general terms, and now Sara Carracedo will give a more detailed presentation on how the different countries have performed with each indicator.
Gracias, Bernardo.
Thank you, Bernardo. I am going to share my screen. Can you see it?
Sí. Muy bien.
Perfecto.
Yes, go ahead. Very well then. Thank you, Bernardo, once again for explaining the specifications for each one of the indicators and the objectives for this project and how it took place. And now I'm going to talk about the outcomes and the progress status in Latin American Caribbean countries that were evaluated using these indicators. As we have seen, the first indicator talks about legally binding instruments that are consistent with international standards regarding research with human participants. And here we see achieved, partially achieved, or not achieved, which are the countries that are yet to meet the indicator. Now, in terms of this first indicator, we can see that over half of the countries have met the indicator, and they do have these legally binding documents governing health-related research with human participants. Even in some countries, there's more than one legally binding instrument for that purpose. But we still have some countries that are yet to fully meet what this indicator provides for. Usually, the challenge that these countries face is that even though they do have some sort of research that regarding health-related research with human participants, those regulations aim at covering a subgroup. So, for example, clinical trials, leaving out a big number of types of research with human participants. Now, there's other cases, for example, Jamaica, where even though there are regulations governing research, these regulations are not legally binding. In any case, something that sticks out from this evaluation on this particular indicator is that even though not a lot of countries have legally binding regulatory frameworks, or they are limited to just a group of types of research, research in these places usually takes place adhering to research ethics standards that include, in addition to ethics review of protocols, other things. However, it is an issue because not having these legally binding tools make the situation kind of precarious, because at the end of the day, adhering or not adhering to the standards will be up to the parties involved. We also believe that countries are aware of the situation, and there are a lot of initiatives underway to try to help them satisfactorily meet this one indicator.
Número 2 hace
Now,
referencia
the second
a la
indicator
existencia de un órgano
refers to
nacional
having a
encargado de
national
la supervisión
body
de los comités de
tasked
revisión
with the
clínica.
oversight of
Normalmente
ethic
vemos
review
que
committees.
11
And here
países
we can see
de
11
Latin
countries
America y
from
el
Latin
proceso
America and the
evaluador
Caribbean
cuentan con este
have
ente nacional
this national
que
body,
usualmente se denominan
which is
comisiones
normally
nacionales de
called
bioética,
National
comités
Bioethics
de ética
Committee
o de
or
investigación, o
Research Ethics or
incluso en
Bioethics
algunos
Committee,
países es
or some of the
provincial
countries even
de
have
un
an
ministerio de
agency
salud,
that's
¿no?
part of
Un
the
ministerio
Ministry of
de salud.
Health, or a division of
En
the
este caso
Ministry
también
of Health.
muchos
In
de
this
los
case,
países que alcanzan este
many of
indicador
the
no
countries
solamente
that
cuentan
meet this
con un
indicator
registro
not
que
only
además
have
suele ser
a
abierto
record
al público
that tends to
sobre los
be
comités de
of
ética,
public
sino que
access
han
on
establecido procedimientos
on
de
ethics committee,
acreditación para
but
los
they also
comités de
have
ética, por
accreditation
ejemplo.
procedures for these ethics
Los
committees.
países que están en progreso
Now, the countries that
para
are
alcanzar
underway,
este
that is to
indicador
say,
que
on their
podemos
way to
ver
meeting
acá,
this
en algunos
indicator, are
casos
the ones listed here.
cuentan
And in
con
some
estas
cases,
unidades. Sin
they
embargo,
have
estas unidades
these
no están registrando
units
a
or
los comités,
divisions,
por ejemplo, a los comités de
but they
revisión
do not
clínica,
register
y en
these
otros
ethics
casos
committees. And in other
solamente se
cases,
centran en los comités
they
que
only
evalúan
focus on the
clínicos y no,
committees that
digamos, en
evaluate
toda la
clinical
investigación en
trials
seres humanos,
rather
porque eso es
than
considerado parcialmente logrado.
human research as a whole, and that's why it's considered partially
El
met.
indicador 2,
So,
muchos de los
with
países de la
in
región
terms of the second
tienen
indicator, a lot of the
esfuerzos en curso
countries in the
para
region
poder alcanzar
have
este
efforts
indicador.
underway to try to fully meet this
Sobre
indicator.
el indicador 3,
Now,
que
in
se
terms of
refiere a
the
las
third
políticas de
indicator, which
desarrollo del
is having
entrenamiento de
policies
los
that
profesionales
support
investigadores y
research
de los
ethics
miembros de los
training
comités,
for investigators and ethics review
vemos que 7
committees,
países
we have
han
7 countries
logrado o
that
alcanzan este
have
indicador de manera
met
satisfactoria. Sin
this
embargo, la mayoría
indicator fully.
de los países
However, the
evaluados
majority of the
tienen un
countries
nivel
evaluated
parcial
have only
porque
partially met this indicator,
hay políticas de
because
entrenamiento
even though they do
no
have training
solamente
policies,
dirigidas a los miembros del comité,
they
sino
tend
que
to
este
focus on
se deja
committee
de lado
members, and
a los
oftentimes they
investigadores.
leave out
Esto, sin
researchers.
embargo, y esto es importante recalcar, no quiere decir que en la
It's
región
important to
no se
highlight that this
lleven
does not mean
entrenamientos o
that the
capacitaciones o
region
cursos
does not
de
provide training
capacitación.
or
Por lo
courses
contrario,
on research
sino
ethics, quite the
que
contrary. But rather, what it means
ofrece estas
is that since
oportunidades de
these
manera no
opportunities are
digamos,
offered
sostenida
not in a sustained way as part of the policy, all these efforts end up not being part of an institutional effort, and that again, it is up to the will of the parties to do that.
Sobre el indicador 4.
Now, in terms of the fourth indicator that refers to having the requirement to prospectively register clinical trials in accordance with WHO standards, we must say that in the region we have three primary records that are part of this network, this WHO network CT ACTRP. And out of these three countries, which are Cuba, Peru, and Brazil, only Cuba is the one that has fully met the indicator, because in the case of Peru and Brazil, even though they do have a primary record and they are recording clinical trials prospectively according to WHO standards, clinical trials that they do register are those who involve pharmaceuticals and medical devices. And we know there's a lot of other types of clinical trials, and these are not being registered or recorded either by Peru or Brazil. Now, the other countries that are in the partially met category also required having a prospective registration of clinical trials. However, they do not meet WHO standards. Or they only register a subgroup of clinical trials, such as the case of Peru and Brazil. And it's important to note that these 9 countries have no policy for prospective registration, such as Bolivia, El Salvador, Jamaica, Trinidad and Tobago, etc. And in general, even though a lot of the countries do not have this requirement as part of the regulatory frameworks, what happens in practice is that at the request of the sponsors or institutions, a lot of this research is recorded on records that are part of the system. For example, clinicaltrials.gov. But the idea is to move towards having this registration of clinical trials in accordance with WHO standards. Now, the fifth indicator that refers to having policies on responsible conduct of research, we only have Peru as having met this indicator. So Peru is the only country that fully meets this indicator because their regulation defines counterfeiting, manufacturing, and plagiarism. And the information, which is the minimal requirements, like Bernardo said. And now we have Colombia and Panama as partially meeting the indicator because they have some of the definitions, or they have these definitions in documents that are not legally binding. And the majority of the countries in the region do not have policies on the responsible conduct of ethics. And finally, in terms of indicator number 6, that is to say, having procedures to do a thorough accelerated ethics review of research during emergencies, we have Panama, which is the only country that has fully met this indicator. And it has specific regulations defining the necessary operational procedures for the National Bioethics or Research Bioethics Committee do everything related to the health emergency in question. That is to say, in our case, it will be COVID-related research. Brazil and Peru are in the partially met category because they have some kind of mention to this in their legislation, but they do not have clear procedures to do this accelerated review of ethics. Now we have the not met, and we have a lot of countries there, and this situation changed as a result of COVID. This has not been evaluated as part of this project, but during our next seminar, we will focus on this topic and on this on the progress made during the COVID pandemic.
Dado todos estos
And
resultados,
having presented all of these results, I go back to you, Bernardo, so that you can continue.
Gracias, Sara.
Thank you,
Paso
Sarah.
entonces a la
Now
última parte
I
de
move
la
on
presentación,
to the last
que corresponde
part of
a
the
algunas
presentation,
recomendaciones que
and it has to
hemos
do with
formulado
some
a partir de
recommendations
nuestro
that we have issued
análisis
based
de
on
cumplimiento de
our
indicadores.
analysis of compliance with indicators.
Estas son las
These
recomendaciones.
are the
Cinco
recommendations. We
recomendaciones
have 5.
que son propuestas sobre cómo creemos que a nivel regional
These are proposals as to how we think that we could make progress regionally in the attainment of these indicators. Let me cover them one by one.
La primera recomendación
The first one is that the ethical governance should cover broadly the environment of research with human subjects. Due to historical reasons, ethical governance has been focused on clinical trials for pharmaceutical products. This can be explained through the globalization in the pharmaceutical sector that have led many companies to carry out trials, and at the same time, countries have a need to protect their populations through legal standards. Many countries have regulations, but not many have ethical standards that cover trials with human subjects. So in general, not only in connection with the ethical review by an ethical committee, national bodies and training bodies, among others, should cover all sort of research on human subjects, and this also includes the last edition of the SIOMS guidelines that states that the term research related to health has to do with the guidelines that have to do with activities directed to develop or contribute knowledge, generalizable knowledge on health. And then in the classical environment for research on human beings, as well as observation research and clinical studies, as well as other research that is being done with human beings. The second recommendation has to do with establishing and consolidating national bodies for the supervision of the ethical committees and other roles. As Sarah indicated, many countries have established bodies to supervise these ethics committees. Some are known as Bioethics Committee or Ministerial Committee on Research or on research ethics, and they have different roles. We think that these bodies to supervise ethics can use a systemic approach for the research, and this is a capability that is already existing and that could be used to continue to make progress in connection with the indicators. For example, with the recording or registration requirement, and also by addressing questions posed by the committee. In this way, they would be acting as consultants and also supplying education and training for researchers and committees. And here we see that the national bodies can help with the compliance, not only of the indicator that is related to these national committees, but also the rest that has to do with bioethics and education. Other challenges we have are to properly establish the purpose of these bodies. Some are only in charge of pharmaceutical products, and it is possible to show the purpose of these bodies so that they can fully comply with a systematic or systemic approach for ethics review. And also, these national bodies have been established in paper on official documents, but this has not been properly reasoned and in a way that is consistent a long time. Clearly, we need a national body, and when this national body only exists in paper or virtually, is not effective, so we need them to properly operate. A third recommendation is to promote responsible conduct for research. This is an emerging topic, and as we have seen, has been insufficiently reflected in national official documents. It is mentioned, but sometimes in passing, and also suggesting that researchers need to be responsible. But we also need to indicate the type of inappropriate scientific conduct that has to be avoided and what would be the methods or the steps to follow in case that happened. And this also requires official documents that show, for example, training for researchers and also continuing education. And again, it is not enough just to teach what is responsible conduct for research, but we also need to promote responsible conduct or behavior nationally with efforts for the compliance with legal and ethics regulations, so that if the countries face irresponsible ethical conduct, they already have mechanisms to assess, to oversee, and potentially to penalize what has happened, so that they are not ad hoc responses or improvised responses given events of this sort. A fourth recommendation is to promote international cooperation to facilitate that clinical trials be recorded in a WHO ICTRP database. This network that belongs to the International Platform for the Registration of Clinical Trials with WHO allows for registration once the information is available in a standardized fashion for all the public. That is to say, it has to be within reach of all of the public and also of the scientific communities, so that scientists may be aware of the research being conducted, the studies may be mentioned, and also to favor transparency and public trust in research. As Sarah mentioned, there are 3 countries that have a registry that is on WHO ICTRP. These are the RPCEC from Cuba and REBEC from Brazil. So for a country to comply with the indicator related to the registry, the countries do not need to have a national registry, but the researchers within the country need to have the requirement to register their research in a registry that is part of the network, for example, clinicaltrials.gov. Now, the existence of these 3 registries at the national level also allows us to see these registries in Spanish and Portuguese. They're part of the network. It's not necessary to create a new registry, for example, in the language of the countries of the area. And these registries may be enabled for other countries to use them, which is not always possible to date, but we can make greater progress towards having these registries that may be used by other countries. It is also important to make progress. So this registry has to be mandatory for clinical trials, not only clinical trials and pharmaceuticals, for example, as we see in other countries, but for all of the clinical trials and also for any research on human beings as established in the Kinsinski Declaration. Finally, the last recommendation has to do with the fifth indicator, that is to say, to develop specific procedures for the ethical review in an expedited fashion of research during emergency situations. And these procedures should not only be mentioned, but they're as well as the expedited research and the creation of the committee, but there should be some specificity as to what would be the review, how the committee will be created. And we saw that this is missing, but data collection continued up to the pre-COVID-19 period. And as Sarah showed us, only 3 countries showed some progress in this area, but we know that during the COVID-19 emergency, several countries in the region were able to make progress. For example, they also based this on previous experience with Zika and the flu, and we are going to see in a later session. This is in connection with the recommendations. Thank you, Bernardo, for these final recommendations. Please remember that you can include your questions under the Q&A button to be able to address them as a whole. But the first one I am going to mention has to do with the indicators and the content of the regulations or within the countries. What should these indicators tell us when the content does not follow international standards? For example, Sophia is telling us that in the case of Chile, the legislation, the laws does not allow for research on individuals who have no ability to accept, that is to say, disabled individuals. So they have the standard, but the standard goes against the promotion of research ethics. We had another example from Colombia. There is a rule in Colombia, but it doesn't have any legal effect in case of non-compliance. What is the relationship between these indicators and the content of the regulation as such? I don't know whether Carla or Bernardo would like to add something. Thank you, Sarah. I can start and Bernardo may want to add something. It is important to mention that this initiative on indicators was seen as a regional initiative that attempted to identify the key elements that could be used to indicate where we were and where we were going to. What does it mean that we are taking a key topic? That means that we are leaving others aside. For example, if we look at indicator number 1, there we see that it says that there is an attempt to adopt ethical standards for any research on human beings according to international guidelines. But as Bernardo mentioned, we are looking into it. So we could analyze each aspect of the international guidelines, but it would not be possible as an initial effort. So we see that there is less requirement for this sort of ethical requirement in scientific research. This is a dynamic effort. That means that as we move forward, we are going to have more precise indicators. The idea is to be always evolving, and this is an idea that it is acceptable, that is to say, to suggest a series of indicators that assess the contents of the national law on ethical research. And for example, we know that in our region, everything that has to do with researching children or pregnant women, even the use of placebos, are topics in which we are a little bit more lagging behind than in connection with international standards. So I think it is possible to do the same for the policies that encompass responsible actions in research. This is a question by Gabriela Duque from Colombia. Colombia is one of the countries that has pushed the most to include this topic in the agenda. First, we include it, and then we are going to move into the details. And I think that Dianira is saying something in the chat that is completely correct, that the policy is the first step, then we need research processes, sanctions, etc. So this is the work that we have ahead of us. And before I give the floor to Bernardo, I would like to say that we know, as Bernardo well knows, that there are several initiatives underway in the region, very important initiatives in the region for the strengthening of ethics and research. And there are some initiatives that are well underway in Trinidad and Tobago, Guatemala, El Salvador, others that are underway in Honduras, Bolivia, Jamaica. But if we do not make this effort now to show where we are, it won't be possible to envision the significant progress that we see in our region now. That's why we are in urgent need to show this regional snapshot, not to show the ugly side of the things, but to visualize the significant efforts underway. This is where we are right now. We are going to say, wow, we have improved a great deal. And if we had had a previous exercise, our colleagues from Panama and Peru, to see where they were before this substantive exercise that is being implemented by several countries in the region. I would like to add that indeed, when we started with this project, we saw that there was more than one way to comply or make progress in connection with an indicator or an objective. And that's the reason why it was necessary to be specific as to what we were going to analyze and take as a parameter to determine that we had attained that indicator or not. For example, the fact that there is a national body that supervises and has a registry of all of the ethical bodies, and there are several ways in which this body can report to other government entities. So there are different ways to attain, but we said that it had to be documented. That is to say, the establishment had to be part of an official document. There had to be evidence that it had been created and some functions had to be met. So we try to be general to reflect the progress made and how progress can be made in connection with each indicator. Thank you, Carla and Bernardo. And since you're talking about this specification in connection with the indicators, we have a question about indicator number 3, research ethics for members of the committee and also researchers. What are the countries that are leading this? And what is the component to measure this? Carla, I think you were going to answer this, and then Bernardo, please go ahead. I said we are going to answer all together. As to this indicator, and based on the training policies, we specifically measured that official documents such as legal standards or any legal document from a national bioethics body should state that training will be provided or that there is a specific body or entity that has the responsibility to train And that has to be put in writing, and it should be binding for the individuals in the country. We do not supervise or oversee the implementation of the training. We just make sure that there is a political will to implement it, and also the compliance of the countries was different in connection with this indicator, because this included the participation of bioethics committees and also researchers, but only a handful of the countries met both sides of this requirement, as Sarah mentioned: Argentina, Colombia, Costa Rica, Panama, and Venezuela, as well as Peru. 7 countries out of 22. There is a large number of countries that meet this requirement partially, because it doesn't include other groups, but many of the countries trained, as it was mentioned by Carla, are receiving the training. This is not part of the national policy yet, though. Yes, certainly. This is a very important comment, Bernardo. We see that in our region, there is a great deal of work done in the area of bioethics and training. We see that the committees, the associations make remarkable efforts to train. However, oftentimes those efforts are limited, for example, to the availability of resources. And the idea that there is a national policy is that it shouldn't be done just because there are some resources left, or if someone is going to make an extraordinary effort. It should be a matter of policy, so that it allows for sustainability, the allocation of resources responsibly. And I think that this is going to help do something systematically, something that is being done with great effort in the region, and not only thinking about the ethics review committees, but also thinking of the researchers, because oftentimes we forget that the researchers are key in this national research ethics system. The idea is to distribute and think about not only the tasks, but also the different actors and the different levels of responsibility. We need to think about this very thick fabric we need to make sure that this is research with ethics. Thank you, Carla and Bernardo. Now we're going to expand on indicator number 4 that has to do with the registration in the ICRP platform. And the first one is, how is it assessed? How do you assess the observance or adherence to WHO registries? And also, it would be a good idea to insist on this idea of clinical trials, so that it is clear why. Clinical trials with pharmaceuticals as regulated trials do not guarantee compliance with the standards. If you wish, I can start as to clinical trials in general. If you look at the first recommendation by Bernardo, the idea is that we need to see that the efforts for research ethics governance cover all of the trials with human beings. We know that there are some important initiatives in the region, but they only cover clinical trials with devices and medicines, pharmaceutical products, and the definition or ethical governance should not only be limited to research on human beings for these topics, and in the specific case of the indicator that requires a definition of the clinical trial, we have that for the registration of clinical trials, and for that definition, we use the definition of clinical trial offered by WHO from the ICPRT platform. I shared the link with you. And Sarah has also copied the full definition. As long as we have different areas of intervention that are prospectively assigned, we can say that there is a clinical trial. That intervention does not need to be with a pharmaceutical product. We see that in some of the countries of our region, there are some regulations for trials on medicines and devices, and there is a different one for other ends. And we see how those trials that do not include medical devices are up in the air. So it would be important that those provisions that have to do with clinical trials and those regulations that pertain to clinical trials need to cover all of the clinical trials as defined by WHO. Bernardo, would you like to add something here? No, I think that it is clear. And the indicator that has to follow the WHO standard is registry. That is to say, we need to make sure, the country has to make sure that researchers register their research in the proper registry that has to follow WHO standards. And this is a part of the standards, the country standards in the ICPRP standards. Thank you, Bernardo. I also wanted to add something here. And this has to do with the need or there is no requirement for each country to have their own primary registry to feed all of this information, but the idea is to register the research in a primary registry with WHO. And that on the one hand, but now that Carla was mentioning clinical trials and all these large group of clinical trials that are up in the air, many countries in the first indicator show partially indicated, partially attained because they only focus on clinical devices and pharmaceutical products. And this is the natural evolution of the research in this region and in the world. First, we have focused more on clinical research. It could be because of the perception of risk or because of adherence to industry standards, but we should also make sure that we have governance for all of the research on human beings and go beyond the limitation to pharmaceutical products and clinical devices. Just a question by someone who is working on the registries. Why would we register and how would the countries use this information? Because it seems that it doesn't make any sense to request the registry if we do not know what to do with that information. So the justification to, this would be the justification to register something. Would you like to comment on that? Certainly. I think that the pandemic has made it very clear how important it is to know what other clinical research is taking place somewhere else in the world. When one conducts an investigation of the ethics in research, we see that there is a favorable outcome. But if we do this 20 times, we are registering 20 times, or we are enrolling 20 times the same number of individuals for the same registry. So I think that we need to start looking at this registry of the product as something closely related to research ethics. My colleague, Ludovica Renee, is in charge within PAHO of evidence and the key elements that have to do with the registration in clinical trials. He has published documents referring to the clinical trial registry in the region, and he has also shown that in many cases, the registry is not prospective, that is to say, before enrolling, registering the participants, but it is done retrospectively after the trial has been conducted, and that the registry is being used as a way to tell you what has been done, but that is not the purpose of a registry. To tell you what has been done, you can go to the journals and you see that there is a very rigorous peer review. The registry is to know what is being done to avoid duplication of efforts and to be able to add more efforts and to know what is coming next and what is underway.
Many countries in the region made significant efforts to register their research, but it's not possible for anyone to review, I don't know, 200 registrations from each country.
confluyan en una
So we
sola.
need all of these registrations to converge on a single platform so that in a snapshot we can see what clinical trials are being done anywhere in the world on any given topic.
De hacer de
So
registrar
that's a key part of having a registry of the ICTRP platform requirements in English.
decirlo en inglés.
I said the acronym in Spanish. I'm just so used to saying it in English. It kind of sounded weird.
Gracias, Carla. Aquí tengo otra
Thank you, Carla. I have another question here that in general refers to indicators, and it's asking whether WHO could insist, and in which way they could insist, so that decision makers, be it ministries or healthcare providers in general, implement all of these recommendations and indicators in practice.
los implementen.
That is to say, so that they are truly implemented. And here there's a list of examples, for example, for coordination between research and health priorities in the country, or responsibilities of each one of the actors, or the need to give momentum to the responsible research conduct indicator, etc. So what does PAHO do about that?
Quizás en cierto sentido nuestros colegas de Perú
Of
y
course,
Panamá
it is very important for us to share information about this. Our colleagues from Panama and Peru talked about this in our previous session from their point of view.
trabajamos cercanamente
At PAHO's bioethics program, we work closely with the different health authorities that are in charge of research ethics governance. So our technical cooperation efforts imply that there has to be an ongoing dialogue, which is very important for this analysis or recommendations that Bernardo shared with you.
nos dan
And this is because they shed light on what kind of challenges the countries are facing. So our work with the countries in general imply that we need to begin with a situation analysis. That is to say, where are we using these research ethics indicators? Where are we at? What do we still need to do? How can we work together to achieve this? Given that we are halfway through indicator such and such, what could we do? And this is what they ask. What do we recommend? For example, Fernando was asking the question, with the National Bioethics Committee in Mexico, we had multiple sessions and we discussed each one of the indicators, where we're at, what could be done. And all of these meetings are between the health authority and PAHO. They're not public, of course, but I think it's important
para toda la
to share for the entire research ethics community the news that the health authorities are doing a lot to try to strengthen their research ethics systems. So we at PAHO always suggest the following. Whenever there is, for example, a policy draft or a bill of law, for example, the case in El Salvador currently,
socializado, que
to
se busque
share that, to socialize it, to seek feedback from all parties involved. However, this is a process, and the first part of the process is quite private. That is to say, it's not made public until you have something to share, some kind of output. But yes, a significant portion of the technical cooperation in research ethics comes from PAHO.
Gracias, Carla, por la
Thank
respuesta.
you, Carla, for that answer. Now we have a question that has to do if we could give us a little bit more detail on indicator 5. Indicator has to do with scientific integrity or responsible conduct of research. So I don't know, Bernardo, if you can speak to that or speak a little bit more about this indicator. Yes, that indicator is a good example of the challenge that it was to try to specify how to measure indicators. And because it's a pretty general indicator and it says that the country must have policies in place for the responsible conduct of research. And there might be many different ways of having policies aimed at that. So what we said is simply that countries should have this policy in writing, like to say in a document, talking about the responsible conduct of research, but it wasn't enough to just mention that ethics should be conducted in a responsible and ethical manner, but rather to include a standard definition of what we understand by responsible conduct of research. That is to say, conduct that does not imply the manufacturing, forfeiting or counterfeiting or plagiarism. So in order to meet that indicator, we need to have a document including a definition of these aspects of how to responsibly conduct research. However, there's only one country, Peru, that met this indicator and had this detailed in an official document. It's interesting to mention the case of Colombia. I see that there's a question on about Colombia. Well, they have a document that to a greater degree than other countries refers to the responsible conduct of ethics, but it falls short of defining the concepts of manufacturing, counterfeiting, and plagiarism. So this is like an initial step, as you can see. At least it is part of a public policy that has identified and defined what the responsible conduct of research is, but it's a pretty modest indicator in the sense that from there to implement a culture of responsible conduct of ethics, a lot more needs to happen. But this is the first step that is yet to be taken in the region. Thank you. Bernardo, just to clarify, it's very important to highlight that the idea, especially for the indicators that are harder to meet in their region, the idea is to start at least taking a first step and to encourage us working on this. In our previous session, we were saying that if the indicators were way too demanding, for example, is for the integrity indicator, we were to require the entire country to have a full-fledged system to deal with integrity and research, then maybe the indicator will be so far-fetched, so ambitious that it wouldn't motivate any country to take any positive steps. So the idea is to take baby steps and along the way think about what would be reasonable given the current status in the region. Thank you, Carla. I believe we still have time for a couple of questions. Even though the indicators are to evaluate national systems, what happens if I'm an ethics committee or an institution or agency where the authorities are not yet meeting those indicators? How could I use these indicators? Or what kind of advantage can I take as an institution where research takes place, an academic institution, for example? How can I take advantage of these indicators which are used to assess national research ethics systems?
Um, inicio con un comentario.
Let me begin with
Sabemos
a
que nuestra
comment.
comunidad
We know
ética de la
that
investigación,
our
que está compuesta
Research Ethics
primariamente
Committee, which is made up
por
primarily
personas que son miembros de ética de la
people that are
investigación,
members of research
además
ethics,
de hacer su
in
labor en
addition
el
to
comité de ética
doing
de la
their work
investigación,
in
sabemos
their
que son muy
Research
activos
Ethics
en su
Committee,
rol de
we
abogacía
know that they're
por
very
mejorar
active
la
in their
ética de investigación en
advocacy
sus países.
efforts to
Creemos que en
improve
este sentido,
research ethics in their
en
countries.
su rol de
So in this sense, we
abogacía,
believe that in
son
this
capaces de usar los
advocacy
indicadores
role, they
para
can use
generar
the
un
indicators
diálogo
to
en sus
start a
jurisdicciones
discussion
sobre
in their
dónde,
jurisdictions
cuál es el
on
siguiente paso que
what's
deberíamos
the next
tomar,
step
que
that we
deberíamos
should
tomar para mejorar
take
la ética
in
de la
order to
investigación.
improve
En
research
algunos
ethics.
países, estoy pensando por
In
ejemplo
some countries,
en
I'm
Argentina,
thinking
ha
about
habido un
Argentina,
esfuerzo
for
también de
example,
usar los
there was
indicadores
an
para
effort to
evaluar
use the
la
indicators
situación no
to
solamente a nivel
assess the
nacional,
situation, not only at
sino
the
como Argentina
national
es un país
level, but
federal
also
a
because
nivel de
Argentina
cada
is a
una de las
federal
provincias.
country
Ese
at the
también es otro
province level
uso
as
que se
well.
le
So
puede
that's
dar.
another use of this.
Bueno, en mi percepción un poco personal de
My
los
personal
indicadores,
opinion
creo
of
que
the
logran un muy
indicators
buen balance
is that I believe they
en no
achieve a
perder de
very good
vista
balance
la
between not losing
generalidad
sight of
y
the
las diferentes dimensiones
general
que tiene
aspect
un
and the
sistema de
different
revisión ética
dimensions
o que debe tener
of an ethics
la
review
supervisión ética de
system,
investigación en un
for
país,
example, the
pero
ethical
al mismo tiempo
oversight of
poder
research in a country, and at
llevar
the
a
same time
respuesta
to
a
try
acción,
to
porque es lo
translate conduct
suficientemente
into
detallado como
action
para
because it's detailed
eh,
enough
mostrar hacia dónde
to
se
show
podría
where
avanzar
we
la
could
mejora
move
de
towards
la
in
supervisión
improving
ética en cada país.
ethics research in each country.
Gracias, Bernardo. Creo que
Thank you,
también los
Bernardo.
indicadores pueden
I
ayudar
believe that the
para
indicators can
que cada
also help
actor pueda identificar sus
for each
responsabilidades
actor to
dentro de este sistema,
identify
¿no?
their
Por
responsibilities or their
ejemplo, tal vez
role
como una
within the
institución donde se
system.
realiza
For example, an institution
investigación,
where
debe
research
tener,
is done,
por ejemplo,
I,
los
for example,
institucionales
must have institutional
preguntar acerca de la
policies on the
investigación, luego
responsible
exigir a los
conduct of
investigadores que
research. So I
pasen
must
por un comité de
ask
ética, también
my
tener
researchers to go
ética de
through an
negociación
ethics
o los
committee. I
estándares
must have ethics
internacionales,
committee that adhere to
etcétera.
international
Entonces, creo
standards,
que
etc.
es decir,
So
ya para
I believe that
identificar
it will be
las
useful
responsabilidades
to
de cada
identify the
actor en este
responsibilities of each
gran
one of
sistema
the players in
ética de
this
la investigación.
big research ethics system.
Y aquí hay otra
There's
comentario,
another question
que viene
slash
de
comment
Cuba y en específico lo
from
que pasa ahí,
Cuba
creo que en
and
todos
specifically
los
about the
países de la
situation
región, es que
there, but it
como el
applies to
indicador
other countries in the
cinco,
region.
que es también
And it has to do with
sustentabilidad y
indicator
aprendizaje
5 that has
responsable,
to do
no
with the
solamente es para
integrity
la
and responsible conduct of
investigación
ethics.
en salud de
It's
mujeres,
not only
sino para
for
la
research
investigación en
with
general.
human
Es
beings,
decir,
but for
hay indicadores
research
que
in
se
general.
aplican
So
a
there are
toda la
indicators that can
investigación.
be
Y
applied
es
to
esta
research in general.
perspectiva, por ejemplo, de Carla
And
Lasaña,
this
que
brings
nos
us
enseñaba
back, Carla,
en la
to your
sesión
example of
pasada.
the
Entonces, tal vez podemos
lasagna layers
hacer
that you
un
talked about in our
comentario
previous
sobre
session.
ese tema para
So
que
we wanted to make a
vean que el
comment on this for
cumplimiento,
you to
digamos, de los
see that
indicadores no está amarrado a lo que
complying or meeting the
indica
indicators
la
is not
autoridad
tied
sanitaria o
specifically
la
to what
autoridad de
the
salud,
health
sino que
authority
debemos
or
hacer
you know
como
any
sistema
other authority does, but rather to have an
Sí,
overall
por
view of the
supuesto.
entire
El
system.
comentario de la lasaña.
Yes. Now going
Yo de
back to the
hecho no logro
lasagna
comer una
comment,
lasaña sin pensar
I
en la
I
ética de
don't
la
think I'll be
investigación,
ever
pero
going to be able to
vemos, y
eat
estoy de
lasagna
acuerdo
without thinking about research ethics. But let
a
me
la
go back
recomendación número uno de
to recommendation
Bernardo,
number 1
que hay
that
un
Bernardo gave us.
desafío en la región
And let us
por
remember
lograr
that
que la
there's a challenge
gobernanza
in the region
ética de
to
la
try to
investigación, que
have
las normas que
the
gobiernan la
ethical
investigación con seres humanos
research governance and
apliquen a
rules
todo
that
el ámbito de
govern
investigación con seres humanos.
research with human
Muchas veces
participants to
aplican
cover all
solamente un
areas because
subconjunto,
sometimes they
como
only
es el de
apply
los
to a
ensayos
subset, for
clínicos de
example, clinical
dispositivos y
trials for
medicamentos.
medical
Entonces,
supplies
la idea
and
es que
medicines
toda
or
la investigación
pharmaceuticals.
con seres
But the idea
humanos
is for all
tenga, por
research
ejemplo,
involving
revisión
human
ética previa.
participants to
Hay
have, for example, a
provisiones,
previous
por ejemplo, el registro
ethical
de ensayos
review.
clínicos que
But
por
there's,
lo
for
menos de
example, the
momento
registration of clinical
solamente
trials
están,
that for the
a mi
time
entender, se
being
están aplicando a
only
los ensayos
apply
clínicos. Hay
to clinical
normativas
trials, and there's regulations, for example, best clinical practices or regulatory authorization processes that only apply to clinical trials for medical devices and pharmaceuticals. So the idea is that for each type of research involving human participants, to have all the different lasagna layers that we must have. This is not about treating epidemiological research as if it was a clinical trial for devices or pharmaceuticals, but rather to make sure that for each type of research, we have the right governance. For example, what we've mentioned before, definitions of manufacturing, counterfeiting, and plagiarism, well, of course, that is for all types of research, not just those involving human participants. So these are multi-tier efforts. A lot of them overlap, but at the same time, these are efforts coming from different agencies or different parties involved that share certain roles. Everybody has their role, but there's also distinct roles.
Gracias,
Thank you.
Carla, por la aclaración.
Thank you, Carla, for the clarification. And to conclude, the question that I think is obvious in this second seminar is the following. What is the outlook of these indicators at the regional level, and what could we do if one of these indicators is missing? As a country, when we already have a law, and we know that sometimes it is difficult to change laws or implement different ones, how are we doing and what could we do?
Inicio yo, ¿quieres iniciar?
Sí,
Dale, adelante, Bernardo.
Bernardo, go ahead. As to what we could do, let me make a comment. I was thinking about what we can do in our own countries to improve indicators. And I think that on the one hand, there are indicators that only need a bit more than a documented policy. And an important step is to oversee the compliance with that policy. The national body is watching that it is actually being implemented. So that is one step. Now, when there is no rule or law, we might be talking about an amendment to the law or a new law. And that's when we can look at the indicators to make sure that we can implement this in the next standards. And on the other hand, I think that there is also public policy that could follow a different path. It may not be as high as a law, but it could follow the path of another ministerial regulation or another binding document that could be easier from the legal standpoint. I would say that this is a very good comment, Bernardo. This is one of the important lessons learned is that even though in our region, I would say that we are really attracted to the law because we resolve issues in the law that are issues that are not solved at the same level in other countries. In my opinion, an important lesson has been with the work conducted with Trinidad and Tobago. They suggested the development of a national policy for research ethics, and a policy go through different approval processes, different from a law. And as our colleagues from Trinidad and Tobago mentioned, it is reasonable to use a strategy to strengthen the challenges in research ethics. In the work we do with the countries, we have seen that oftentimes many of the topics may be solved through decrees by the authority in question. For example, the clinical registry as part of a registry of the ICPR platform. This is something that can be reasonably managed with a degree of a lower rank. At PAHO, and let me say something in connection with what Fanny said, we have several initiatives underway in the region. We offer technical cooperation. As I mentioned at the outset, we have support by Wellcome Trust to do it, not only as we used to do it, that is to say, not only to offer comments for regulatory proposals, but also to support countries in the development of the drafts. It is quite tedious work, be it bills or policies, preliminary policies, or other documents. It is quite a tedious job, and we need to be the devil's advocate and be very critical of how something could be misinterpreted. As I just mentioned, we do underscore the importance of these efforts to also become public. If we argue about the role of all of the actors and all of the other parties to research ethics, we also promote the existence of a space for discussion within the country, criticism, reflections as to how to improve this regulatory document regardless of its nature. We have facilitated these processes also in Peru, Guatemala. Now, for example, El Salvador is working on research ethic governance with active engagement of PAHO. And from the point of view of the organization, that is our work. The health authorities count on us to offer this support, and all of the parties in the system, I think, have a special role to comply with as advocates and to advocate for this issue. And we are past the times when the ethics committees had no dialogue with the health authorities. I think that we need to take advantage of this and also increase the proximity with the ethics committees and those who fund research, the health authorities, the researchers community, because I think this is key to strengthen the system. Thank you, Carla. Bernardo, would you like to add a comment here? No. Very well. I think that there is something here mentioned in connection with the committees. I apologize, I got distracted. In the committees on the use of lab animals. When we started to develop the indicators for research ethics, I had a list of almost 200 potential indicators, and I was thinking of capturing each of the details and components of the system. And I went through a very long learning process, reviewing all of the other indicators, and the Pan American Health Organization does work with indicators. This is just not a creative idea with bioethics. And I sat down and reviewed all of the indicators with the other areas of the organization, and I realized that one of the difficulties with these indicators is that the indicator is the progress tracer, is the tip of the iceberg. And I was trying to just take a snapshot of each section of the iceberg, and I had to make an effort in selecting that tip of the iceberg, and that's where the difficulty lied. So fortunately, thanks to the work conducted by many experts on research ethics, we determined what the best tip of the iceberg was for each topic, but each tip of the iceberg may be complemented. And as we move as if we move forward and in the region reaches some indicators, and you are going to see that we're going to have a similar session in a year, and you're going to see the progress that we will make. Some indicators will stop making sense, and we'll have to add others. And I think that in the future, we will have to include indicators for research with animals, because as we mature, as we get this topic ripe in the area, we're no longer focusing on the big aspects, but we are also focusing on other elements that has to do, for example, with research and its impact on the environment. We're talking about gene drive and how we have other components that go beyond research with human beings, and in the future we will have to see how we can fine-tune additional indicators to reflect the progress. I thank you for this clarification on these equivalent aspects, and it's close to 2:30. We have no further questions. I thank the participation of you all. Carla, Bernardo, I give you the floor to conclude this session. On my behalf, this is Bernardo. I would like to thank you for the possibility to cooperate in this project, and thank you for all who send their very kind comments and questions. Thank you, colleagues. I would also like to take up this opportunity to thank the interpreters that make this dialogue possible, to include our colleagues from the Caribbean and other regions. And once again, thank you all for the trust to have this space for reflection, for dialogue. I would like to thank all of the participants, and we invite you to join us next Monday when we will be focusing on the emergency indicator, and I think that we will be able to see what is the significant progress that has been made in our region. Thank you very much, and have a nice rest of the day. Thank you.